Welcome to the Healthy Habits for Active Aging podcast with your hosts, physical therapists Dr. Michael Gorman and Dr. Lauren Bennett. This podcast will discuss a variety of health-related topics focused on educating the aging adult, allowing for an active lifestyle no matter the age. Don't forget to rate, subscribe, and share. Enjoy the show.
Hello, and welcome to another edition of the Healthy Habits for Active Aging podcast. This is episode number 16. I can't believe time's going by so fast. We are your hosts, Dr. Michael Gorman
and Dr. Lauren Bennett.
We are two physical therapists from the beautiful city of St. Louis, Missouri. And yes, winter is fast approaching, unfortunately. Sounds like a good time to take a trip to the Bahamas, huh, Lauren?
I would be okay with that. You want to give me another week off?
Yes, anytime. So tonight we're going to talk about something that, Lauren and I don't prescribe. We're not physicians, but we have treated so many patients over the years that have received a cortisone injection. So we're going to talk tonight about when you would use it, why, good, bad, all that, and we will share with you our experiences.
So what is cortisone? What is its purpose? Well, its purpose is to relieve pain and inflammation. It's very localized. Doctors can get directly to the point of what is the area that is inflamed. Sometimes it's guided by ultrasound, other times it's not. Cortisone is a type of molecule. Also, people have heard of it as a corticosteroid, but it's a precursor to the hormone cortisol. So when we talk about cortisol, to leave it plain and simple, it's a hormone in our body that has to do with stress and inflammation. And so this cortisone injection will relieve the inflammation that is essentially leading to the pain of soft tissue and nerves.
And it fixes things, right, Dr. Bennett?
No. So there's pros and cons of it. One pro is that sometimes it helps relieve pain, but I, as a physical therapist, and Dr. Gorman would probably agree, it does not fix the issue, but it allows us to be able to work with the patient a little bit easier because now we can work through what's causing the issue, but the patient is not as irritated as they were previously.
And so common diagnoses that require or could require cortisone injection. Let's talk about that. Yeah,
sure. Probably the most common diagnosis is arthritis, knees, hips, shoulders. I see it a lot. It can be used for gout, bursitis, tendinitis. I've had patients with, the tennis elbow and the outer side of their elbow joint is achy. Trigger finger is one. Some people don't know what it is unless you've had it, where your joint, the tendon in your finger sticks. So cortisone has been known to help with that. Gout, if I haven't said that. There are some conditions, I will give it to some people. If you're one of the few people that says, I had a cortisone injection and it only took one and my pain never came back. When I was reading on it, there's this really fancy diagnosis in your wrist and hand called the Quervain tenosynovitis, and that is a condition that has been known to have an injection and to never have come back. So
yeah, and other things that we've seen injections for frozen shoulders. No, it's not when the shoulder gets cold. That's when the shoulder essentially locks up because of some kind of inflammation, pain, trauma, and the person no longer has the ability to move their arm, to move their shoulder, and essentially the fluid in the joint that should be nice and thin and move around and help with the joint, that fluid in that joint gets real thick. And so kind of like I like to tell people, it's sort of like if you gone 10,000 miles to get your oil change instead of maybe 5,000, the oil gets a little thick. Well, that's what happens when you have adhesive capsulitis or frozen shoulder. Cortisone can help. Oftentimes, what would you say, maybe 2 to 4 months, 2 to 3 months, it can be effective?
Yes, that's pretty much what is showing in the research, 2 to 3 months. And then you can have them pretty much every 3 months. I'll do them about 3 times a year.
Okay. And so, when I have a cortisone injection, what what should I expect? Should I expect to be pain-free immediately? Should I be be able to do jumping jacks and backflips, or what's the deal?
So initially, the people they feel amazing, essentially, and sometimes they use lidocaine with the injection too. So don't get false hope, that's not necessarily lidocaine, or it is the lidocaine. It's not necessarily the cortisone.
Mhm.
But most commonly, it takes about 7 to 10 days for that cortisone injection to kick in to get relief. So don't be alarmed if the first couple of days you're like, it just didn't do anything for me. Give it some time. But the lasting effects, like we said, is about 2 to 3 months, sometimes shorter, sometimes longer. And talk to your doctor too. Sometimes they just got to find out where exactly to get it.
And
Sometimes it's
my experience tells me, sorry, I didn't mean to be rude
no,
and
go ahead.
interrupt, but my experience tells me that, you know, if you say, let's say, for example, if you get a series of 3 cortisone injections, it does seem that the first one is a little bit more effective. And then the second and third, my experience, if they're on the same body part, tend to be a little bit less effective. Is that, would you
Yeah,
agree with that?
I would definitely agree with that. And I don't know if it's like a psychological component maybe of it too, because you were in pain, you had this injection, and it created like such relief that you were like, oh my gosh, that was a miracle worker. So then the next time you're experiencing that pain, you think, well, that happened to me last time, it should happen again. And it doesn't necessarily happen like that every time. So my
Right.
opinion.
Well, we know that long-term cortisone use is not always healthy for our body. So let's talk about some of the adverse effects.
Mhm.
And again, I'm not going to say this will happen, but this could happen.
Sure. There's some short term, there's some long term. The short term ones could be something simple like a headache, facial flushing. If you're diabetic, they do see a temporary increase in blood sugar levels, also temporary increase in high blood pressure, maybe some increased appetite. But the things that we want to look at more are if you're just somebody that's like, every 3 months, I need a cortisone injection to my knee because that's when my knee pain comes back, you're putting yourself at risk for cartilage damage, bone degeneration, risk of infection. And then when we're talking about like tennis elbow, you're a tennis player, let's just get a cortisone injection every 3 months. But what you really need is physical therapy with the cortisone injection, build up the strength of the wrist extensors, make those tendons stronger so it doesn't come back. Like we said, it's not fixing the problem, but lets you deal with physical therapy a little bit easier. But repeated cortisone injections to a tendon puts it at risk of weakening and potentially rupture.
Right. So please understand, everyone, we don't want you going to your orthopedic surgeon tomorrow and say, "Oh, this crazy woman on the on this podcast said that I shouldn't get 3 injections a year and it's putting me at risk." No, we're not saying that, but it's our duty as educated medical professionals to tell you that if you have repeated cortisone injections, this could happen. Again, you're injecting a foreign substance into your body. It's just like taking pills for too long. It's the same type of thing, but with the cortisone injection, it's a very localized, specific injection.
Yes. Yeah. So something to talk with your doctor with, but something also to be educated about, not so that way you're just like craving the next cortisone injection.
Yeah. Do you like how I said this crazy woman on this podcast? They didn't hear from me. They heard it from you, Lauren.
Oh no. It's okay. I'll take one for the team.
Sure hope we have all your insurance paid up.
So really cortisone, it's a simple topic. It's just something to talk with your doctor about. There's pros to it, cons to it. There are pros, like what Dr. Gorman was saying with frozen shoulder. I mean, all the research out there shows that the most effective treatment for frozen shoulder is cortisone and physical therapy, to have manual therapy and exercise. So that one does show you cannot have one without the other as effective. So but
Yeah.
also,
So, yep. So we're talking about, are we talking, how many injections can we have a year into the same area.
Well, and that's the thing is it depends. Like if we're talking knee joint, you got risk of bone degeneration and cartilage damage, but I think you can have more than like a tendon, like an Achilles tendon or a tennis elbow area, because they'll probably only do 3 ever because of the tendon weakening and the risk of rupture. So to a
Yeah,
tendon versus a joint.
right. And trust me, take it from a guy that had tore his Achilles tendon. You do not want to soften that tendon up and get Achilles rupture.
No, no.
Anyway,
Not with
I think at this point in time, we're going to take a little short break. We're going to do a commercial break and hear from our sponsor, iMove PT. So we'll be back with you in about 30 seconds. iMove PT is proud to be the sponsor for the Healthy Habits for Active Aging podcast. iMove PT is a mobile physical therapy company based out of St. Louis, Missouri, and expanding throughout the United States. We bring a unique one-on-one physical therapy experience to the privacy, safety, and convenience of our patient's home, office setting, or the location of their choice. For more information about iMove PT, please go to www.imovephysicaltherapy.com or feel free to email us at info@imovephysicaltherapy.com. Have a great day. All right, well, welcome back, everyone, to the Healthy Habits for Active Aging podcast. We're continuing with Lauren and I are continuing to talk about cortisone injections, good, bad, should you get them, should you not, and we've talked about this already, but it's crucial to understand that if you are getting cortisone and if your physician has told you need that, that's totally fine. We understand that, but you truly do need to combine the cortisone with some skilled physical therapy as well, because the cortisone, just like Dr. Bennett said, it decreases your inflammation, but it doesn't do anything to make your connective tissue in your body stronger and better able to tolerate just daily stresses. So we need you to make sure that you're hooking in with a good physical therapist while you're getting your 1 or 2 or a series of 3 cortisone injections.
Sure. Manual therapy combined with cortisone injection is best because let's be honest, the reason why you're having your symptom is usually because of overstress to either the joint or the soft tissue. So the physical therapist can tend to get in there, figure out the postural impairments, why, is the joint not moving properly? So like you said, get the inflammation to calm down, and then you can tolerate physical therapy and manual therapy specifically better.
Yeah, and there's other injections as well that we'll talk about in future podcasts. There's something called PRP. There's hyaluronic acid, which is typically done into knees. So there's all kinds of different types of injections out there, and we'll save that for an upcoming podcast.
That's right. So a little recap today, things to remember. First and foremost, speak with your doctor and choose what's best for you. It depends on the location of your pain and your personal risks, especially if you're diabetic, like I said. And then, like we already said, it's most often not a cure, but it's just a decrease in pain and inflammation to allow us to cure it through physical therapy and strengthening and flexibility.
Absolutely. Well, I think everyone now on the podcast has a much better idea of cortisone. Should I get it? Should I not? And the side effects. So it's good to again share the education and get some good stuff out there. Well, we're really excited about next week, and since we're now doing these via Zoom, one really cool thing is now it's going to be much easier to interview friends of ours, other medical colleagues that we feel can come in and share their great knowledge with the Healthy Habits for Active Aging community. So next week, we have Dr. Manish Suthar. Dr. Suthar is what's called the physiatrist. He is a physical medicine physician that's based out of St. Louis, Missouri. And Lauren, what's Dr. Suthar going to be talking about?
Yeah, he's talking about his most common things he treats is the spine. So he's talking about what he can do for the spine as far as evaluation and treatment. He's conservative, so he does do a lot of injections. He also plays the fastest growing sport right now, which people know as pickleball. So he's really excited to throw that in there and talk about activity and what's encouraged and pros and cons of things like pickleball when it comes to spinal rehab and pain.
Well, I know he's a very competitive person. So have you ever played him on the court?
I have in recreational games. I have. I enjoy it. We run into each other quite frequently on the court. It's fun.
Who wins?
It's 50-50.
That is a very good answer.
I'd rather play with them. Let's put it that way.
All right. Well, so we're looking super forward to that. So please come back and join us. If you like this podcast, we love it when people share this podcast with their friends and family. Now you can search us up on YouTube. Lauren's going to become an overnight star. And so please look at us there as well. But if you have any questions for us, please always email us info@iMovePhysicalTherapy.com. And we hope you have a great week and look forward to seeing you back next week.
Thanks. See you next week.
We hope you've enjoyed this episode of the Healthy Habits for Active Aging podcast. If you have any questions for Dr. Gorman or Dr. Bennett, please send an email to info@iMovePhysicalTherapy.com. To learn more about healthy aging, visit our website at iMovePhysicalTherapy.com. Like what you hear? Be sure to rate and subscribe. See you next week.